Healthcare Kent is a local organisation that champions health and social care. I'm joined by Phill Thorne, who's going to tell us all about the organisation, but more importantly, how it can help you. Hello, Phill.
Hello, Jason.
Right, so let's start by understanding your organisation. What is Healthwatch Kent?
Absolutely. So Healthwatch Kent is here to listen. We're part of a huge network of organisations across England that are all Healthwatch. Healthwatch Kent is here to listen. We want to hear your health and social care experiences, good or bad. Can be anything you like. Can be from trying to get hold of your GP, dentist, could be something a lot more serious. So primarily what the first thing we would do is if you were to contact Healthwatch, and I'll give you all the contact details at the end, what you would do is we would listen to you, because sometimes that's what you just need to do. You just need to be able to talk about your experience with someone who will listen. We will be able to signpost you, hopefully in the right direction, for someone that can maybe help. Either, say, for example, if you needed to make a complaint, point you in the right direction of where to make that complaint to, or indeed someone who, if you wanted to take this forward but you didn't know how, then there's an advocacy service that we would suggest to you that you contact to help you make that complaint. So you're doing this with someone's help, as opposed to trying to do it on your own. What we also have as well, which is unique for Healthwatch, is that we have links with the decision makers, the people that have the authority and the decision to get things changed, to make things change. So, for example, that could be the Care Quality Commission, who obviously go out and reviews health and social care services. Kent County Council and some of the commissioners who sort of fund services and set services up, and the Clinical Commissioning Group, what used to be called the CCG, which changed its name a couple of months ago to something called the ICB. All those are the stakeholders, the people who make the decisions for services, and we have those direct links into them, so we can actually say to them, this is what's going on, and what might be going on for a listener in Maidstone might be happening for someone in Marden and in Margate as well. So it's about getting as many different experiences as we can together, and then going to these decision makers and saying, look, this is happening all over Kent. And that's how things change. I'll give you an example of one that we worked with at the start of 2021, when all the pop-up test centres were coming up. We got some feedback through from our friends at Kent Association for the Blind that some of their service users were going along to get tested, but there was nothing there to help them. So there was nothing in large print or no Braille support. And they were hearing this on a regular basis for the first few days that the centres were up. They liaised with us. We got in touch with the people who were setting the centres up through the CCG, through the NHS in the area, and those testing centres within 48 to 72 hours all had large print documents at the centres, all had Braille access, and all had advisor accessibility. So people were there to help at the centres. So we do get quite quick results like that. Some things take a bit longer, but that's a really good example of one that happened very, very quickly. So we want the people of Maidstone and the surrounding area to actually get in touch with us and let us know what their experiences of health and social care are, good or bad.
And health obviously covers a multitude of areas. You were talking there about improving services for the blind. I was at an optician's recently getting new glasses, and I noticed that they also offer hearing services now as well. So could people approach you about these privately run businesses as well?
If there are particular issues that need to be addressed, then yes, we'll go through the necessary authority, or we'll have the research where we can actually say, yeah, right, okay, in order to take this further and make a complaint. So we don't actually make the complaints on your behalf, but what we will do is signpost you in the right direction. And if a particular case comes up which we've never heard of before, we won't say, sorry, we can't help. We will find that information out, and we will be able to say, right, this is where you need to go. Or we will find you out who can support you to make that complaint and take it further. So if you contact us with your experience, we can signpost you the right way.
And Phill, Healthwatch Kent are currently looking into the lack of NHS dentists that are available here in Kent. Now, I know it's an issue in Maidstone, and the British Dental Association have issued a report.
So, well, you've probably seen it on the news yourself. The figure was that only 10% of dentists across the whole of the county were actually taking NHS patients, and that at the time of the research being done, that no practices in Kent were taking any new NHS patients. This comes down to funding. The NHS dental funding contract hasn't been reviewed since 2006. That is obviously something that whoever our new Prime Minister is, when that's sort of elected and put in place next week, it's something that they have to absolutely, react to. Healthwatch Kent, as well as all the other 150 health watches, have had this evidence coming through from the people across the country now. And what we've been doing is gathering all that, sending it to our national body, Healthwatch England, who fed it to NHS England. And actually, they put a few little steps in place to kind of help that. For example, a complex dental case, Jason, is someone who has to have more than 3 teeth worked on. And obviously, if people haven't been able to get appointments, if you get one, you may get another one that's a problem. So the extra funding will go to practices that are dealing with patients that have got 3 or more teeth to deal with. Also, there is a list on the NHS website of all dentists, and a lot of the information is out of date. The NHS England are forcing dentists to actually update their listings, because there's nothing worse. You go onto the website desperate to find a dentist because you're in pain. You find a listing on the website and goes, oh yeah, this takes NHS patients. You phone them up. You sit there in the queue for half an hour to get through. You phone them up and they go, oh no, we haven't taken NHS patients for 5 years. This step may not actually physically do anything, but it will remove a lot of that stress that's associated with it, when you'll be able to find out straight away who are taking NHS patients. And the final thing is that there are some NHS practices who aren't working efficiently. And so, as well as obviously giving money to those that are, in terms of these extra cases, the NHS contract is going to take dental money away from those that aren't working efficiently, which means that obviously then patient choice, because unlike a GP, when you're assigned to a GP, you stick with that GP practice. With dentists, you can actually technically register as many dentists as you want, because you can get the same service wherever. So where people are knowing that there's funding for NHS, they're more likely to go there. So it incentivizes those dentists that aren't performing effectively to actually up their game so that they can keep getting their funding. So those are the 3 initial steps. Obviously, Healthwatch Kent and all the other health watches want them to go further than that and just give generally more funding. But this is the first step that NHS England have taken with it. And when we move forward, and as we said, when the new Prime Minister goes into place, then that will need to be addressed. And hopefully, funding go up.
Okay, great. Now, listen, Phil, if it's all right with you, let's take a break. When we return, I want to talk a little bit more about the waiting times to see a doctor and all that sort of stuff, waiting times for surgery if you need to, like a hip replacement, all that sort of stuff. The effect for us here in Maidstone and in Kent, and also specific to Maidstone as well, the podiatry clinic, which is moving from the centre of Maidstone a little bit further out into Coxheath, so we can talk all about that when we return. Is that right? On Maidstone Radio, and I've got Phill Thorne on the line. Phil is talking to us this afternoon about his organisation, which champions health and social care here in Maidstone and the wider Kent. It's called Healthwatch Kent. And Phil, one of the concerns that I know people have been getting in touch with you quite a lot about is delays in getting appointments, say for doctors, or even more worrying, for operations.
Absolutely, and we really want to hear more, Jason, because what has happened is the knock-on effect in services. Obviously, some routine appointments have been put back a long period of time. People are finding that in some cases they're having to wait. The waiting list could be 2 to 3 years for, quite frankly, a routine operation. So what we are hearing a lot more is that people are actually paying to go private. And so we want to hear about why people have actually chosen to wait. Is it particularly because the inconvenience of the situation you find you're in? Are you in pain? Is it just that actually you want it resolved so you're not particularly in pain, but you want it resolved so you can carry on with your life, so you're not sitting and waiting for things to happen? People are making these decisions to actually, pay for it. And of course, what's happened since they've made that decision and got the funding in place is then everything's gone up. We've got a cost of living crisis on our hands now. So people are now worried how they're going to pay for it. So they've had the operation. People are worried how they're actually going to pay for it. So what we're calling on as Healthwatch right across the country is for, as I mentioned earlier on, when the new Prime Minister's in situ, to actually address the issue of backlogs as soon as possible, but also for NHS England to kind of find a way of actually supporting people whilst they're waiting. Because as I said earlier on, they could be waiting 18 months, 2 years, 3 years for a routine procedure. And so people just don't hear anything for long swathes of time. So what we're calling on is the NHS to find a way of actually keeping people informed of what's going on. We're not going to magic new operation slots straight out. We're not going to get new surgeons in, new consultants, new specialists in place overnight, but we can manage these waiting lists better, and we can, get feedback from people as to their experiences. So we hear stories about people going on waiting lists, waiting for doctors' referrals, then referrals not happening immediately. And then unfortunately what happens is when these referrals don't happen, people's conditions have got worse. And in some cases, possibly even life-threatening conditions because of these delays. That's not specifically what we're talking about. However, that's how it is. It's more the routine operations, the routine procedures, knee replacement surgery, hip work, eye operations potentially, where you may or may not be in pain, but you might want to just get control of your life, take your life back. And so you make that decision with discussion with friends and family, and you find the wherewithal to actually go private and get it done. But then now we're in a situation where everything's going up, and it's like, well, how do I pay for that as well? So we want to hear people's experiences. Did you make that decision to go private? How are you feeling about it now? Because again, for one person who might be listening in Maidstone, someone else in another part of the county might have had a similar experience. So it's about feeding those experiences back to the NHS, to the people who make the decisions, to the people who are running the waiting list, and say, look, this is what people are doing. And the more we can go back to them with, then the more they'll actually look at acting on it and getting things sorted out.
As a national organisation, are waiting lists in Kent particularly bad, do you think, compared to other areas?
I'll be honest with you, Jason. I think if we actually looked at some of the other areas in the country, yes, we are. I don't have those figures to hand, but certainly our focus, and I'm part of the team that actually is on the phone on a daily basis, talking to people and hearing these experiences and talking to community groups and talking to organisations, and everything it's such a long wait to get things done unless you go private. So people, and that's what people are actually being told when they contact GPs. If you're waiting for it on the NHS, you're going to be waiting, but you could always go private. And people are doing that. People are making that call to do that. And obviously they're then wondering how they're going to afford it afterwards. So we want to hear about all those experiences from as many different people. It doesn't matter whether your experience is good or bad, because that all goes into that feedback that we can give back to those people who make the decisions.
Okay, can you just, for anyone who might be in that position right now, can we just give them information on how they would get in touch with Healthwatch Kent?
Absolutely. Well, for those people, and there might be some people driving at the moment, when you get a chance, just Google Healthwatch Kent. We come up there straight away. But for those people who are listening and have got pens and paper ready, then our phone number is 0808 801 0102. It's a local rate call. So it's 0808 801 0102. You can drop us an email, info@healthwatchkent.co.uk. And our website, which goes through what we've spoken about today, goes into more detail about us and about all the projects we're working on at the moment, is www.healthwatchkent.co.uk.
Okay, that's brilliant. Right, Phil, if it's all right with you, we're going to take one more break. And then when we return,
that's fine.
Let's talk about that Maidstone-specific issue. The podiatry clinic, which is moving location out to Coxheath, and we think there may be some issues for local residents, and you want to hear from them. Okay, so what we'll do is let's take a break, and then we'll return to that. It's Maidstone Radio. It is home time. Speaking to Phill Thorne from Healthwatch on Maidstone Radio, and I'm joined on the line by Phill Thorne from Healthwatch Kent. Phil, thank you for sticking around this afternoon.
Not a problem. Loving it.
So we've talked about dentistry, we've talked about waiting times. Now, a bit more Maidstone specific, the podiatry clinics here in Maidstone, now they're moving them out to Coxheath.
Yes. So the podiatry services that were run by the Kent Community Health Foundation Trust, which happened in Foster Street, they're going to be moving this month, basically because of feedback that the people who run them have had, that the building's showing its age and it's not as accessible as it used to be, and parking over there is limited. Because it's on that hill in sort of in that area, access to the site can be difficult. So what they've done is they found a couple of options. One is at the Cox Heath Clinic, and the other is at the Churchill Centre at the Royal British Legion Village, Preston Hall. They're going to be set up there. There is parking available at Cox Heath. There's public transport to get there as well. The sessions will run at the same times, and the staff will be the same. So patients will actually see no physical change within the team, but it's the location. And we've had feedback through that this makes it a bit difficult for people to get to, because they now have to catch buses or potentially get transport over there. And so we want to hear from the people of Maidstone if they are being affected by this. And the best way they can do that, as I said, is get in contact with us via the contact details that we gave earlier on, or indeed if they want to let you guys know, and then you'll pass it on to us. Are you being affected by this?
What are the contact details again? Let's just hear them again.
So the phone number is 0808 801 0102. If we're not live at the time, then do leave us a message. We will call you back. You can also email us info@healthwatchkent.co.uk. Our website, www.healthwatchkent.co.uk. You can contact us via the website there. There's a option there to kind of fill in some forms or fill in a form and actually give us your feedback. You don't even have to put your name and contact details in there. If you just want to say, this is really awkward for me, because we can use that feedback and take it forward.
Okay, but from an end user perspective, so I'm an end user and I've just found out that the clinic that I'm used to using is moving out to Cox Heath. If I contact Healthwatch Kent, what is the best outcome I'm going to achieve? Because obviously we know that clinic is moving. We know you've told us some of the reasons why it's moving. We know that nothing we can do is going to stop that. So I'm just wondering, if I did contact you, what would be the benefit to me?
Well, what we would find out from that individual person, particularly if they give us contact details, is the reason why it's difficult for them. And potentially it could be because of transport. So we could look into whether or not they're entitled to patient transport to take them over to this. And if we would, then we would put them in touch with them. There may be a volunteer driving service locally that may be able to help them and take them to the clinic. It may be because actually they're housebound and it used to be something else that used to get them into the town centre. So each individual case we will assess. It may be that our bank of information may not be of any use, but at least we are feeding this feedback back to the people who run the podiatry services for West Kent to actually say, you probably should have done a little bit more. They're acting on a huge amount of feedback that they got that the building in Foster Street isn't accessible any longer. But we want to hear how many people that's actually affecting.
Yeah, because that was going to be saying, do we know, I suppose you've just answered my question there, which is I was wondering how many people are likely to be affected by that change, by that move. I guess they've calculated that sort of thing, and they've decided that for the amount of people that it affects, it's all right to move it out of town.
I think the accessibility issue is a big thing as well. People want, as people are getting older, and accessibility needs are vital. And that building, obviously on Foster Street, doesn't give that. So they looked at locations over at the Cox Heath Clinic and over at the Royal British Legion Village, which are more suitable. But, as with anything, not everyone's going to be happy with it, Jason. So it'd be really good if we could get as many people who are listening who are affected by that to let us know, and we can obviously feed that back.
Right, so anyone who's just joined us and listening into that conversation, Phill, you're from Healthwatch Kent. Give us a very brief summary about who you are, what you do, and how people can get in touch with you once again.
Right, Healthwatch Kent is here to listen. We're part of a huge network of organisations across England that are all Healthwatch. Healthwatch Kent is here to listen. We want to hear your health and social care experiences, good or bad. Can be anything you like. Can be from trying to get hold of your GP, dentist. Could be something a lot more serious. Please do give us a call, 0808 801 0102. You can email us info@healthwatchkent.co.uk, or you can look us up online. You can Google Healthwatch Kent or go to our website directly, www.healthwatchkent.co.uk.
And it's also useful, as we were talking about right at the very beginning, about if you're having problems accessing services, actually Healthwatch might be able to point you in the right direction.
Absolutely. Yeah, nothing is too small.
Phill, thank you very much for your time, and we'll hopefully catch up with you in 5 or 6 weeks' time.
That'd be awesome. Thank you.